Hello, everybody. My name is Ali Cleaves II, and I am a Texas A&M University Commerce junior, and my major is public health. So right now, I will be giving you a presentation on what iris implant surgery is, and I hope you guys like it. So a lot of you may be asking, what is iris implant surgery? Iris implant surgery is when a cosmetic surgeon takes an artificially made iris made of silicone and folds it and inserts it into a slit in the cornea, typically used to give someone a different eye color and restore vision. So, who does this surgery help? There may be graphic images, as you can see. They were a little bit hectic for me to see. I don't know if it's the same for you guys, but anywho, the target patients are, or for this surgery, would be people with conditions like coloboma or aniridia. Coloboma, which is in this image, a condition where tissue is missing from the eye from birth. Iris resembles a keyhole, generally does not cause vision loss, but may cause vision problems depending on the size and location of the coloboma, whereas aniridia, described as the partial or complete absence of the iris, these abnormalities may cause the iris to be misshapen or irregular, can cause sensitivity to light. Okay, so, uh, darn it. I'm sorry about that. As seen in this image right here, this is aniridia. As you can see, mostly all of her iris is gone. Whereas in coloboma, you don't necessarily have to, it doesn't have to be specifically the iris tissue. It can be any tissue of the eye. It can be the sclera, it can be the lens, it could be even an eyelid. Whereas, or like, as you, wait, did we already go over the iris? Well, if we did or didn't, I'll just say that one too. Because as you can see, only a small portion of her iris is gone, whereas in this photo right here, nearly all of her iris is completely gone. And then, when was this surgery invented? This surgery was invented in 1978, or known as iris fixation. It was first created to treat cataracts. It was a lens implanted on both sides of the iris to correct cataracts. It was originally created to use an artisan lens created by John Worst to treat the plethora of cataracts patients while he was visiting a Pakistan hospital. How is the procedure done? It can be done in a single procedure. They slit or make a small incision in the limbus. Next, they insert the artificial iris over the old one and suture it into position. The cost. So in the US, this surgery costs $3,000. In the United Kingdom or UK, this surgery costs $2,700. In Thailand, this surgery typically costs $2,000, and in Turkey, the cost of this surgery is $1,200 or $1,200. Risks. Okay, so the risks of this surgery: increased chances of vision loss, blurry vision, corneal abrasion, watery eye or allergic reactions, and itchy eyes. Why would anyone get this operation? People could get this surgery in order to simply change their current eye color to something more desirable, but people use it to correct pre-existing problems with their iris, such as coloboma or aniridia, as previously stated, things that consist of ruptured irises. And last but not least, we have our reference page, which consists of all the places that I got my information. And that concludes my presentation. I hope you guys had as much fun listening as I did giving this presentation. Honestly, I'm thankful for this because I didn't necessarily know there was even a condition like this, or even if there was a treatment like this for conditions like the one we just heard of. So, like if I ran into someone like this on the street, I wouldn't, I, I would just be in shock. But now I know that not that I would treat them any differently. It's just a condition. They're human like everyone else. That's a little joke for you guys. But anyway, yeah, I hope you guys had a wonderful time listening. Thank you for listening, and this concludes my presentation. Have a good one.